According to PubMed.com, consumption of sugars, sugary foods, and beverages has a higher risk of cancer.
Doctor says.
No sugary food. Okay? So kahit po prutas yan, even if it's fruits, even if it's a processed food or whatsoever, you are not allowed to touch it. Don't touch it, don't look at it, don't you ever smell it. Okay? Because the cancer cells, they have 96 receptors for sugar, while the normal cells has 4 receptors per sugar. So imagine if you are a cancer patient and you are eating foods that are very, very sweet, your cancer cells are just eating, so they are growing. That's why it's very important not to eat foods that are rich in sugar. So when you talk about sugar, marami yan. You have your glucose, fructose, sucrose, diba? Galactose.
Cancer cells have 10 times the receptors for insulin compared to normal cells. What does that mean? It means that these cancer cells love sugar. In fact, when you do a PET scan, what do they measure? They're measuring the consumption of sugar in the diagnosis of cancer. So I know the problem is if you're going to cut the sugar out, you're also going to starve your own cells, right? So that might be the general thinking of it, but in reality, what you want to do is you want to switch the entire fuel source of what you put in your body. You don't want to run your body on sugar. It's a very dirty fuel. It creates a lot of other problems with other organs. So if you run your body in ketones, which is the byproduct of fat burning, you'd be much better off. So there's many things you can do to actually feed your body to not only prevent cancer, but to reverse cancer, as well as avoid certain things so you don't get cancer in the first place. But I think this point is very, very important of switching your entire fuel source from sugar burning to fat burning.
Ketogenic diet is very topical at the moment, and I get asked about this very often. The ketogenic diet is one that has moderate amounts of protein, very little carbohydrate, and a large amount of fat. So most of the energy comes from fat. The theoretical principle behind it is because cancer cells preferentially use glucose. So the idea is that if you push the body into only using ketones, then it means that the cancer cells don't have an opportunity to use as much glucose as they would do normally.
So whether the ketogenic diet is the best diet once you get cancer. Okay? Well, here's my viewpoint based on the data that I have. I believe that a healthy ketogenic diet with intermittent fasting and periodic prolonged fasting can prevent cancer. And it is the diet and program to prevent cancer. Why do I say that? Because the actual cause of cancer is mitochondrial damage. And there's nothing that destroys the mitochondria more than metabolic syndrome and high insulin in a diet that is high in sugar. Creates massive damage to the mitochondria. So this is why healthy keto and intermittent fasting is what you need to do to prevent cancer.
Consult a keto or low-carb doctor in your area.